Following up on the most recent case of measles, there is more important information to know if you've been exposed. Tonight, Beth Warden asks our state epidemiologist the questions we're hearing from others about when they should get tested. This is a 5:30 Health Alert.
Individuals in these venues don't know each other oftentimes. We did need to put out the public notice.
State epidemiologist Dr. Josh Clayton says that before the most recent patient with measles started to feel sick, he was still contagious.
Starting on the 29th of January.
And they attended several public events and spaces in Millbank and Brookings. Anyone who could have been in contact needs to keep their exposure time frame in mind.
Monitoring themselves for symptoms of measles for the next 21 days from exposure.
If you feel sick with a fever, runny nose, or other symptoms and could have been exposed, Clayton believes it's best to talk to your doctor.
Exposed at these events should have a low threshold for reaching out to their medical provider to talk about testing.
It is possible for newly vaccinated patients to have a false positive.
If you or your child had recently received a dose of MMR vaccine, and that's looking at it within about the past 2 months or even 3 months.
I checked with several medical providers for advice. At Sanford, Dr. Ashley Sands says it's important to call ahead before arriving to ensure minimum exposure to others. She says, we will work with the patient and the family to make accommodations for them to be seen at the clinic and avoid waiting rooms and other areas where potential exposures are possible. And at Avera Medical Group, Jennifer Reed, pediatric hospitalist, says regardless of whether or not a child has been vaccinated and is showing symptoms of illness, it is always important to seek medical attention. If you or your child has not been vaccinated, Clayton says don't put off seeing a doctor out of concerns of being judged.
We would love to have gotten you vaccinated on the front end so that so that you would have been protected from the disease, but that will in no way affect your quality of care.
If you or someone in your household is found to be positive for measles, medical staff can advise you on the best way to protect the rest of your family. In Sioux Falls, Beth Warden, Dakota News Now.